You'll have to ask him. He'll let you know. If you ask him nice, you might get what you want. Be careful what you ask for. All right. Happy Tuesday. Turn to your neighbor and say, Happy Tuesday. Happy Tuesday. Okay, we're going to skip the jumping up and down tonight. We're going to save our energy for the important things. Welcome, everyone. All right, so tonight we have the heart health. Really excited about it. I'm glad everybody's here. Raise your hand if you want to learn something important tonight. Say aye. Aye. Excellent. You're in the right place. I can promise you that. So tonight we've got heart health. Next month is cancer prevention. So the top 2 leading disease killers will be covered tonight and next month. So please make sure you have that on your radar because these are very, very important topics. Wouldn't you agree? Yep. Yeah. All right, so what's tonight's talk about? Really, it's about your future. Is your future important to you? Your future is important to me. It's kind of a silly question, but the sad thing is that we don't often plan, so we fail. And if you fail to plan, you plan to fail. If you don't have a plan for your health for the next year, 2 years, 5 years, 10 years, you could wind up anywhere. And if you look at the picture up there, you'll see picture on the left, nice quality of life, health, happiness, family, and the picture on the right is the same person, quite the opposite picture, right? And I'm sure if I was to ask you, everybody wants to avoid that. But the problem is, you know, if you don't do much, if you don't have a plan, you wake up one day and you could be that person in the hospital bed, asking yourself why. Well, tonight we want to ask the questions, why we do what we do, because if you understand conceptually why you're doing what you're doing, you're going to make better decisions, right? And if you make better decisions, what are you going to get? Better results. You're going to get what you want. So tonight I'm going to teach you what health is and what it's not. We're really going to get down to the crux of this. You may think you know what health is. I hope you do. But tonight we're going to dot the I's and cross the T's. Where does it come from? You know, if you think you're healthy, if you're on certain prescription medications, maybe you need to be on. Maybe there's an option for you to not be on it. But don't think for 1 minute that prescription drugs actually create health. Health doesn't come from the outside in the form of a pill, potion, or lotion. It comes from the what? Inside. The inside out. So we're going to learn how to get it when you need it, and also how to get the most out of your care here. You know, why are you here? Are you here just to get your back racked or to get your posture straighter? Is that really all that chiropractic has to offer you? Well, I hope not. But if you're not sure, I hope to make sure that you're sure before you leave here tonight. So let's talk about some cholesterol facts. I know there's some of you in here who are on cholesterol medication. Some of you would like to get off of it. You've already told me that. And I'm here to set the record straight. Everything I'm going to present to you tonight isn't shooting from the hip. It's not opinion. These are all from medical journals. This is well known in the medical industry. And if your doctor still has you on cholesterol medications, then you first and foremost have to assume one thing. They're not reading their journals. Okay? And I know that you have appointments coming up with them. And I know that you're uncomfortable having the conversation with them where you really want to tell them no. But you're not sure of what to say because you've shared this with me. Now I understand, I get that. Well, my purpose here tonight is to help you have a better understanding on that, better clarity, and then pray for your boldness to protect your health. Make decisions that will protect your health because ultimately, is there anybody who cares more about your health than you do? No. So understand this, that first and foremost, just because your cholesterol is high, it doesn't mean that you're in the danger zone. There's no significant risk factor for high cholesterol. People with low total cholesterol have just as many heart attacks as people with high cholesterol. Again, it comes from the Journal of the American Medical Association decades ago. If you do take cholesterol-lowering medications, or you take red brewer's yeast, or you take some sort of supplement, or some sort of diet to lower your cholesterol, guess what? It doesn't reduce your risk of heart disease or risk of a heart attack. And if you do that, you're increasing your risk of other health problems, which are potentially worse. So just take note of that, and then we're going to build on it. Recent study came up, National Library of Medicine. They said higher total cholesterol concentration may be associated with better cognitive performance. How is that possible? How is higher cholesterol associated with better brain function. Well, guess what the brain has? The highest concentration of cholesterol in your body. Your brain needs cholesterol for the neurons to fire. Did you know that? So yeah, I mean, who else is going to teach you about this? Where are you going to get it? The medical doctor isn't going to teach you about it. Their job is to prescribe it. Their job isn't to correct the cause, it's just to prescribe because it's at their disposal from the pharmaceutical reps. That's the industry, that's just how it works. And so when we look at this, we have to ask ourselves, right? Why? Why? Well, God doesn't make junk. The Bible says you're fearfully and wonderfully created in His image. So is there a lack of anything that you were born with? No. And if your cholesterol is high, it's for a reason. If your cholesterol is low, it's for a reason. Wherever your cholesterol is, your body needs it there for a pretty good reason. And if you are fighting cancer or there's some sort of brain condition going on, your body's going to make cholesterol to actually help and heal that condition. Did you know that? Yes. Because all the neurons require cholesterol. Every cell membrane requires cholesterol. So what are you doing in those situations when you're taking the cholesterol down, when you're stripping it out? You're actually increasing your risk of brain problems. You're increasing your risk of dementia. You're increasing your risk of Alzheimer's. And it plays a crucial role in your immune system. So what else are you going to be increasing your risk of? Cancer. That doesn't sound like anything anybody wants, right? So that was the finding of the study. A higher concentration of cholesterol is a protective factor for cognitive performance. Raise your hand if you want your brain on high performance. Yes, all of us. So how is that possible if you take cholesterol-lowering medications or if you're trying to lower your cholesterol with diet or supplements? You're shooting yourself in the foot, right? Doesn't make sense. Parkinson's disease, again, just to highlight how it affects your nervous system. Okay? So researchers in the Netherlands, they showed that higher blood levels of total cholesterol associated with a significant what? Decrease, a lowered risk of Parkinson's disease. On the other hand, the people with the lowest LDL, right? This is the LDL, this is the part of the cholesterol that they're telling you you have to take down the bad cholesterol. Turns out that it's very, very important. People with the lowest LDL had an increased risk for Parkinson's disease by what? By how much? 350%. That's insane. That's significant. That's not a joke. I don't understand how anybody would want to follow these recommendations if they knew the facts out there. How people are being blindly led. Statin medication from an American Journal of Cardiology. So they followed 300 adults diagnosed with heart failure. And what they found was the people taking the statin drugs with the lowest LDL had the highest rates of mortality. What is that? The highest risk of death, early death. Conversely, on the other hand, the people with the higher levels of cholesterol had the lowest risk of death. So what are you learning right now? The higher your cholesterol, the what? The better. Completely the opposite of what you've always understood. Highlighting a study that came out of Japan. 12,500 healthy adults ages 40 to 69 years underwent mass screening examination. Conclusion of the study found low cholesterol was related to high mortality. High cholesterol was not a risk factor for mortality. I mean, we can go on and on, but I think you guys get the big idea here. Other reasons to avoid statin drugs: deplete your body of CoQ10. Many of you take CoQ10 because your doctors hopefully told you that when they gave you the cholesterol medication, because we know of the horrible side effects, potential side effects of statin drugs, right? What is that? Confusion, dementia, what else? Pain. I can't tell you how many people have come into the office and they've had back pains, and it was from the cholesterol medication, joint pain from the cholesterol medication. I know plenty of medical doctors who have taken their patients off of these medications because of this. So it's a well-known fact, side effects. It inhibits the production of vitamin K2. How many of you take vitamin D with K2 in it? What do you know that vitamin D helps to prevent? Heart problems. Partially because of the K2. So statin medications inhibit the production of K2, right? Amazing. the very thing that you're trying to prevent is being caused by the treatment. How about that? And also diabetes. Recent studies show that statins, what? Triple your risk of type 2 diabetes? Are you kidding me? Wow. It's the same type of thing. You take one medication for one problem, and what does it cost? More and more. Yep. So here you have it. Simvastatin, lovastatin, pravastatin. You can find your favorite one right in that list right there. So overall, in the past, how many years? 30 years? There have been 44 different studies that reveal no cardiovascular mortality benefit, meaning you don't live any longer as a result.
At one time, I wanted to see one of those listing of the,
Yeah. The bottom one got cut off. Lipitor, Zocor, Crestor, Lescol, Alteprev, Prevacol. Yeah. And there's more, and there's others there also. So all these studies over the last 30 years, not one of them has shown that people live longer or reducing the risk of heart attack or cardiovascular disease, either from diet or various drug trials. And I highlighted that word diet in red for one reason. Because if I was to ask you this question right now, what can you take to lower your cholesterol naturally? What would your answer be? Don't take the drugs to lower your cholesterol. Why don't you take a supplement or have a special diet to lower your cholesterol? What would your answer be?
fruits and less meat.
What would your answer be? Does somebody have a good answer for that? Okay, so the question is, what can you do to lower your cholesterol naturally? Everything that I just told you and shared with you, avoid that. Thank you. Avoid, no. Did you say avoid fat? Avoid that. That meaning avoid lowering your cholesterol. Everything that I just shared with you showed you that lowering your cholesterol is not a good idea unless you want brain damage and cancer. Did you get that? Or did that just go right over your head? That's why I'm asking you this. Because we're so brainwashed. We can't see the forest for the trees. And here you are because you want to learn more. You want to do better. You want to make the right decisions. But we're so brainwashed and glazed over. It takes so much to wrap our minds around this. Excuse me for being passionate and getting excited. Because I really want to help you get this. All right? So don't miss this. Whether it's getting off your cholesterol medication or taking a supplement or your diet or your exercise or your meat, it's not a good idea to do any of that with the intention of lowering your cholesterol. Are we all clear on that? Turn to your neighbor and say, are you clear on that? All right. Very good. Don't lower the cholesterol, right? If you're going to do anything, you're going to raise one part of it, and I'm going to show you which one that is. So you tracking with me so far? All right. So let's summarize here. LDL cholesterol plays a crucial protective role in what? Brain function and immune system. So you don't want to take your cholesterol down for that reason right there. The latest research on the optimum level of LDL, which is your so-called bad cholesterol, is what? 139 for the general population for longevity. So when you get your labs, write this down. Because if you're going to have a conversation with your doctor and they're going to tell you need to go on cholesterol medications, this is your reference. Otherwise, what are you doing? You just have to take their word at face value. Are you willing to put your life in somebody else's hands? No? That's your total. That's probably not your LDL. That's your so right. So your total is not. The total is the sum of a few different ones. Yeah, that's what they say. You keep it under 200, you're going to be working on developing other health problems. And this is where I'm going right now. The best predictor of your risk of heart disease is not your cholesterol. The best predictor is looking at the total cholesterol divided by what? HDL. Okay, so that's not your LDL. Your HDL. Your LDL is supposedly the bad cholesterol, but HDL is supposedly the good cholesterol. So if you want to know if you're in trouble or not, or you want a reference to cross-check what your doctor's telling you, you look at the total cholesterol and you divide that by the HDL. So let's do some math here. So Joyce, you go to the doctor, he says, your total cholesterol is 260. You need to be on cholesterol medications. That's too high. It's supposed to be under what? 200. Yeah, well, those are the guidelines that were created by studies funded by the pharmaceutical company. No wonder they're so stinking low. Everybody has to be on cholesterol medication to fit that standard. Mine's never been that, and yours shouldn't either. So if a cholesterol level is 240, it may show on the labs that it falls out of normal range, but that doesn't mean that it's abnormal. What you need to look at is that 240 divided by, for example, your HDL. That's a good HDL, the 80. So if your HDL is 80 and your 240 is total, what kind of number does that give you? Who's good at math? What kind of factor does that give you? How many times does 80 go into 240? Who's good at math here? 3. So there's the range right there. What does that tell you? It's good. That's right. You're in the healthy range. You're in the healthy range. So this is what you need to look for on your labs. Now, if you're not sure, bring them. I'll show you. I'll teach you how to read them. But this is just an example of what I'm going to show you to do when you bring me your labs. And so here's another example. Oh, your cholesterol is 299. That's too high. You better get on this medication or else, right? Fear factor. And what do? Go straight over to the pharmacy and fill that prescription. Because we don't know what else to do. We have no reference other than what the doctor says. And just please remember that, your doctor is not God. Your doctor, you don't work for your doctor. Your doctor's not your father. Your doctor's not your mother, right? There should be no fear, trembling, or intimidation there. Your doctor works for you. You don't like your doctor? If they're not supportive of you, guess what? You can fire them. You can fire them. You can go find yourself another doctor. It may be a pain in the butt because you got insurance and all that to deal with, but ultimately it's your health. It's up to you. That's how you have to look at your doctor. They're supposed to be there to support you, to help you, to lead you, to guide you. And if they're not supportive of you, especially when you're using the information you're getting from their medical journals, you have to ask yourself, am I in the right place? Am I in the right place? So here you go, 299. Now again, on the labs, it's going to show a little out of range there, but when you look at the LDL, that LDL, that may seem a little on the high side, but before I would jump to any conclusions, I would look to the HDL. And when you look at the HDL, that's 62, that could be better. That's a little on the low side. That could be better. It should be better. If there were good lifestyle habits in there, it probably would be better. So what can bring up your HDL? Exercise. What else? Because, good fat. Because when you look at that, you divide that 62 into the 299, that's 4.8. Where does that put you? Kind of borderline high risk. Yeah. So again, back to what we were saying, Beatrice. Instead of trying to take your cholesterol down, what you want to do is focus on taking the HDL up. Take the HDL up. You want to focus on the positive. Just remember that. The LDL supposedly is the bad. The HDL is the what? Good. So instead of throwing the baby out with the bathwater, try to focus on the good and raise the good up, and that will improve your cholesterol ratio. And that's what reduces your risk of heart disease or heart attack. Is everybody with me? Say yes?
Yes.
Good. Okay, so in addition to exercise, all the good healthy fats will help to increase your HDL. Avocados, macadamia nuts, what is that? Walnuts, yeah, almonds, extra virgin olive oil, ultraplex EPA, the fish oil capsules, highly concentrated EPA. somebody was asking me about the brand that they were taking. He's like, yeah, I take a fish oil capsule. I said, but your EPA score is low. He's like, well, will this work? And I looked at the label and I saw that it was much higher in the DHA and lower in the EPA. And I said, you know, that's okay. You can take that, but it's really not hitting the mark to move the needle to increase the EPA, which will also increase the HDL. So that's why we use the Ultraplex EPA. It's a much higher concentration of EPA to move the needle in the right direction on your labs. Okay, so here's another thing you can look at, your omega-3 index. Raise your hand if you've had the omega-3 index done. Good. You do the finger prick blood test, and then we give you this, and we show you that the low risk right here is between 8 and 12%. That's where the normal is. We're talking about the amount of EPA in the cell membrane. And the cell membrane is what allows all of the communication in your body with hormones, neurotransmitters. Inside the cell, you have your DNA, you have energy production. So in order for all the nutrients to get in and the toxins to get out, those cell membranes have to be healthy. The cell membranes are made up of the EPA. They're made up of fat. What are they made of? Fat, yeah. So if you are low in that, let's say you're in the 2 to 4%, you have the highest risk of heart disease, Alzheimer's, and eye disease. As a matter of fact, at the 4%, it's a 90% higher risk of sudden cardiac death. So that sounds like a pretty important number to know. So that's the question. Do you know your omega-3 index? No. Many of you don't know what your vitamin D is, right? You know you're taking a supplement, but how do you know you're taking the right dosage? How do you know you're getting enough? So it's the same thing with the omega-3. Maybe even more important. So if you have not had that done yet, ask them. We can make an appointment for you and do it. It's a very inexpensive test, and it will help us pinpoint what we can do to lower your risk of all of these health conditions. What else can you look for on your blood test? The New England Journal of Medicine said in one of their studies not too long ago, inflammation. Everybody say inflammation? Inflammation is an independent risk factor for a heart disease much stronger than any measure of cholesterol, which means that it doesn't matter if your cholesterol is low and you're taking statins. If you have high levels of systemic inflammation, high C-reactive protein, you're at the greater risk for a heart attack. Okay? And it doesn't matter if your cholesterol is super high or your LDL is super high. If your inflammation levels are low, your C-reactive protein is low, you have the lowest risk of a heart attack. That's why when we do the vitamin D test, we also have the C-reactive protein in there also. It's also a finger prick blood test. So again, these are simple tests, and you know what? Your doctor will not do this as a standard lab. They don't check C-reactive protein unless they suspect that you've had a heart attack. So we found a very simple way with a finger prick blood test to get that number. And again, that goes along with anti-inflammatory nutrition, which comes down to the omega-3s and also curcumin and things like that. But you really got to know your numbers, guys. You got to know your numbers. Your health is too important to guess. Wouldn't you agree? Yeah. We don't guess, we test. Exercise. Is exercise important for heart health? Come on, that's a silly question. Come on, what are you doing? Well, how much exercise? Again, quantity-wise, experts usually say somewhere between 150, 300 minutes. If you're like Carlos, you could do 700 minutes a week, or me. No, I won't take my. Yeah, it's not. It's a bad thing when you have to back off. So that's my weakness. And anyway, I would say that if you do a little something every day, that will keep you out of harm's way. A little something every day. That means even if you did a brisk walk for 20 minutes every day. If you rode the bike for 20 minutes every day. But don't forget about resistance training. Do not forget about resistance training. Resistance training is so important, guys. Every study that's coming out these days on anti-aging, preventing dementia, preventing Alzheimer's, not to mention, bone density, osteoporosis, and all that stuff. You're missing the biggest part of what can benefit you, exercise, wise if you're not doing resistance training. Now, you don't have to get under a bench and start pumping iron. Get yourself some heavy hands, dumbbells, go online, look at some of the exercises, but I would do that at least twice a week. At least twice a week. Well-known benefits, we're talking about blood pressure improvements, stress management, helps to raise your HDL, which overall does what? It improves your cholesterol ratio. Is everybody with me so far? Yeah. Did you learn something important? Yep. Okay. One thing, two things, three things.
How long did you say to do resistance a week?
Resistance training, I would do at least twice a week. At least twice a week, yeah. Good 30 minutes. Probably the most important part of all the exercise that you're going to do. Yes, great question. Thank you. Okay, so here's a few more things I can add. 10 years to your life expectancy. Bruce just told me I remember last year or the year before, Bruce is like, yeah, I'm turning 70. Well, yeah, soon I'm going to be 70. And he said, yeah, I think I got I may have another 10 years or so. And that was last year. But this year now, his blood sugar's going down, his A1C's going down, his belly's going down. He's lost like 30, 40 pounds. And so he's turning 70, and now his thinking is, I think I may be good to 90, And I think that's pretty awesome. And so when we talk about life expectancy, we want to think about what are these things that we're doing that are either taking from it or adding to it. And American Heart Association says managing stress. Is that important? Listen, I'm not a pastor, I'm not a psychiatrist, but I do know the Word of God. And the Word of God says, the Bible says that cast all your cares on Him because He cares for you. And I know that the only peace in this world, which is really true peace, that you can hold a plumb line to, that doesn't change with the 6 o'clock news tomorrow, is the Word of God. And I can tell you that this is a huge part of anybody's health. It starts with mental health. Knowing who you are, knowing what you can and can't do, and knowing when it's time to take that burden and give it to the Lord. And if you don't have a relationship with the Lord, or somebody that you can do that with, it's a lonely road, and it's very unhealthy to say the least. So if you need help with that, ask me, because it's not part of my workshop, but I'm sharing with you what is the truth, and the world needs more truth. The world needs more truth. People are searching for the truth. You're here because you want the truth about health and healing. Well, I got news for you. The great physician created you. He knows what you need from start to finish. Not smoking, we know that. Controlling your blood sugar. I'm going to show you what that has to do with your heart health. Controlling your blood pressure and maintaining a healthy weight. I want to share this with you guys just very briefly. I don't want to spend too much time on this, but if you know that if you lost 10 pounds, you double your chances of normalizing your blood pressure. Did you know that? If you lose 22 pounds, you reduce your heart attack risk by 75%. Holy smokes. It improves your cholesterol ratio, improves your triglycerides, A1C, reverses type 2 diabetes, thyroid function. Look at all the birds you kill with one stone just by weight loss. It improves your metabolism. Metabolism happens at the cellular level. When you fix the cell, everything gets well. So, we have a system in our office. Many of you guys know about this. If you don't know about this, we have a fail-safe, foolproof system that will guarantee that you'll lose at least 15 pounds and not just lose the weight, but lose it all in fat. Keep the muscle, keep the water, and you lose the fat only. And there's a manual, there's a journal, there are supplements, we do weigh-ins, we supervise you and hold your hand through the whole program. And it's a metabolic correction program more than it is even the weight loss. So you lose the right weight in the right places, and we measure the health gains as you go through this. But again, it's guaranteed, so just wanted to share that.
Hello, my name is Tim Kennedy. In the first 40 days of this program, I lost 35 pounds, exactly where I wanted to be. I got off my blood pressure medicine, I got off my cholesterol medicine, and I got off my heartburn medicine. And I feel wonderful.
Thank you. Okay, so at any rate, you know, women will typically lose 15, 20 pounds. Guys usually lose a little bit more, 20, 25 pounds. But if you are interested in this and you want to have the body composition analysis where you stand on the scale, we measure your body fat, your muscle mass, your water mass, your fat mass, your metabolic age, all these things. It's not just a scale. Normally it's $99. The event special is for only $37. They'll make the appointment to do that for you. And then there's a $300 discount on the 40-day program that we're doing, which guarantees the weight loss. So that will be applied to that. But first, if you want to see if you are a candidate for the program, you can do the weigh-in. Just ask them before you leave tonight. So here's a question for you. Will foods high in cholesterol, all right, let's say bacon, eggs, your red meat, does that cause the clogging of the arteries, depositing of plaque? Is that what causes that? No. Very good. Your answer's right there. Coronary artery disease has more to do with inflammation. There's that word again. Everyone say inflammation. Inflammation. And what causes inflammation? Well, sugar for one thing. What else? Toxins and bad fats. And since we're not talking about toxicity this workshop, we did that last workshop, we're going to talk about the sugar and the bad fats. So if you look at this, on the left, you'll see all the bad. All the bad and the ugly. What do you see there? Lots of sugar and bad fats. Now you're not looking at M&Ms and cupcakes and a lot of that stuff. What you are looking at is lots of carbs there too, right? Yep. The pasta, the bread, the potatoes, all of that causes your glucose to go up. When your glucose goes up, your sugar goes up, your body's going to store fat, and that's what drives inflammation. Right? So, and that's what is going to close down the arteries. You see that little picture down there? If anybody was wondering what that is? That's what swells the arteries shut. The inflammation from what? Sugar and what else? Bad fats. The hydrogenated fats, the seed oils, canola oil, sunflower oil, all of those bad fats. So we have to try to avoid those because that's what's destroying the cells in addition to the arteries. Now, what do you see on the right side there? What do you see on the right side in those foods there? What do you see? What do you notice in that picture that's not on the left? Yeah, all the good stuff. You don't see any of the carbs. You don't see any of the bad fats. You see good fats. You see almonds, olive oil, avocados, right?
Red meat.
Yeah. You got your red meat, your fish, you got your protein sources. Obviously, you want to get grass-fed or get organic whenever you can. You guys know this. I'm not teaching anything new, right? You got your greens, you got your good fats, you got your low-sugar fruits. Everything in there. You've seen this picture before. But what I'm trying to show you is that when you eat like this, it's not just to keep your belt line down. It's to keep your arteries flush, clear, open, wide open because you have low inflammation. That's what lowers your risk of heart disease. That's what lowers your risk of heart disease. Are you with me so far? Say yes? Yes? Good. Peter, I can't tell. All I see are black glasses. He's sleeping back there. Okay, so that's what you got to do. Make sure that you're getting good fats in there.
So I don't eat the bad stuff. I eat the good stuff, and I exercise too much, and I can't gain weight. I'm low weight.
So we can take a look at that.
Okay.
But you got to make sure that you got the good fats in there, not just the extra virgin olive oil and all that. You see all the saturated fat up there? The preferred source of fuel for your heart is, guess what? Saturated fat, which they've long told us to stay away from. That does not clog the arteries, guys. That's junk science. Coconut oil, you can put that coconut oil in your coffee. You can cook with it. You can make your scrambled eggs. You can fry your chicken in it. Yeah, it'll take high heat very well. And then you got your Kerrygold, you got your grass-fed butter, same thing. You want to cook with these good fats because they're good for your heart and good for your brain. And it's the preferred source of fuel for your heart. So if you deny yourself of that, you can see how it's not a good idea. It's not in line with what we're looking tonight. So heart disease patients who were advised to reduce their saturated fat intake resulted in what? No reduction in death rates, heart attack or stroke. So it's not the saturated fat that's the culprit. And this is, again, this was the junk science that was published many, many years ago. And they got us to buy into buying these things like Smart Balance, the Country Crock. All of that was for profit and greed. There was nothing scientific to support that. In fact, it caused more heart attacks. If anything, it caused more cases of heart disease. So you have to go with the good stuff, which is the real fats, the good fats, the saturated fats. So we've gone through all that. So just, you know, if you have your steak and you have your bacon and you have your eggs, is there anything wrong with that? No. Just choose the healthy kind. Just try to get the grass-fed. Try to get the organic. Now, I wouldn't eat that every day, but if you do eat it, don't feel guilty about it. So here's some supplements. If you're looking to get some sort of support, knowing which supplements support heart health, vitamin D, you guys know that. But again, I would make sure you know exactly what your level is. Because if you're taking 5,000 international units, it may or may not be enough. Sometimes you need 10,000. But the testing will tell you. Vitamin D, by the way, is not just for your heart health. It's an important indicator for your immune system as well. We saw that with COVID. All the people who died with COVID who never made it out of hospital had the lowest vitamin D levels. Remember that? Vitally important. And it also helps to ward off the mental decline. Dementia, Alzheimer's, not to mention your bone health. The EPA that we've been talking about, I can't tell you how many benefits there are in terms of heart health. Your blood pressure, prevents arrhythmia, it protects your heart, it helps your heart make other blood vessels to increase circulation, lowers your triglycerides, it goes on and on. CoQ10, like we talked about, the necessary molecule inside of every cell in your body, which is needed for energy. And if you are on medication for cholesterol-lowering medication, statins, it's a requirement. You have to be on that. You have to. Neuromag I put in there because I will say this. I didn't really talk much about it. I kind of took it out of the slideshow just for time purposes because I tend to get long-winded with these types of workshops. So I took it out. But in one of these other workshops, you know I go through how important sleep is, right? Because when you're short on sleep or you don't get good sleep, if you're not getting good REM sleep, if you're not getting good deep sleep, it throws your nervous system off. It throws it into fight or flight. And that will increase your risk of heart attack faster than anything else. So sleep is a vitally important part of heart health. You guys know this, right? Cool, cold, dark room, regular schedule, going to sleep the same time every night, getting up the same time every morning. Make sure the room is dark. Make sure you're not watching your screens right before you go to sleep. You know, don't eat right before you sleep. Don't have caffeine past 1 o'clock in the afternoon. These are all the things I always go over. Now, if all else fails, and you still have problems, this is a great supplement, the Neuromag. It's magnesium threonate. You guys know magnesium is good for your blood pressure. It's good for your circulation. But this particular form of magnesium crosses the blood-brain barrier. So it not only relaxes your blood vessels, it relaxes your brain. And it helps facilitate better sleep. That's why I put that in there. Does that make sense? Yeah, I'll use this from time to time. I keep some in my closet. If you're having any issues like that, try it. You'll see some good results with it.
So are all those taken together?
You can take them all together. Absolutely, absolutely. And so tonight at the workshop's the only time we ever discount the supplements. So just for 15% off anything that's Ultraplex up there that has the green label like that. Actually, with the CoQ10, we'll do that also, even though it says Thorn. But if you need any of this, see them on the way out. You know, the supplies are always limited with what we have up there. So if you're serious and you need it, make sure you get up there real quick when we finish tonight. Okay, so I just want to pause briefly and recognize a couple of people here. And so, what do we got? Okay. So, the first person I want to recognize is, first person I want to recognize is for perfect adjustment attendance. And so many of you guys are excellent with your adjusting schedule, but just every once in a while we want to call somebody out and embarrass them, make them blush, and just really love on you and appreciate you. Peter Romaine Everybody give him a big round of applause. Music man. Yes, music man. Yeah. Perfect adjustment attendance.
Thank you.
Thank you. I appreciate you. Keep up the good work. And we've got another one for 6 or more workshops. This is our University Core 4 degree, Elevation Health University, coming to 6 or more workshops. This is for Beatrice. Everybody give her a big round of applause. Good job. Constant and never-ending improvement. That's what I appreciate about you. And do we have one more? No? That's it? Okay. All right. So let's go ahead and stand up. I just want to give your bottoms a little bit of a break here, and the brain too. Turn to the person to your right, and I want you to squeeze their shoulders very lightly and get some blood going to wake them up. Get some blood going to wake them up. All right. Is everybody awake? We're not done yet. We've got a little bit more to go. Okay, karate chop. Do a karate chop. Wake them up. Love your neighbor. Don't hurt him. All right, turn around. Love your other neighbor. Good. That's great. All right. All right, karate chop. Good job. Good job. Awesome. Give yourself a round of applause. All right, don't leave. Don't leave. The best part is coming up right now. All right. So the number one factor that will increase your risk, the number one factor that will increase your risk of a heart attack is this right here. What does it say? Your heart attack risk is primarily dependent on the functioning of your what? Nervous system. On your nervous system. Yes. Here's how that works.
Fight or flight.
Yep. So innate intelligence. What is that? What does innate mean? Inborn. What does intelligence mean? Smart. Turn to your neighbor and say, "You're smart." You're smart. Yeah. Inborn wisdom. Well, so you see that picture up there with all the little sperm? That one in the middle, that's the winner. That's you. Give yourself a pat on the back. So upon conception, what happens? Sperm fertilizes the egg. Boom. You have this white light that envelops the cell, right? And that is the moment that God breathes life into you as a living being, right? That's conception. So that's the only time that math doesn't make sense. You have 1 + 1 = 1. Now there's one cell that starts to multiply and divide, and starts to form what? A human being. But God breathes life into that living being. And that's what directs and governs and controls the development of that fetus, right? You remember that, right? Does everybody remember that? Yeah. Okay. What's the first thing to form in that living fetus? Look on the left side there. What do you see?
Spine.
Yep. The nervous system. And so you have that nervous system there because that's the communication highway for that innate intelligence, that life that God breathes into you. The same intelligence that created the living universe is the same intelligence that God gave you when He created you. And that intelligence is what made you to develop into who you are right now. Your heart's beating right now. Your lungs are breathing. Your stomach's digesting food. You can see me. You can hear me. You can smell, taste, touch, all because of which system? Which system? Your nervous system. So your nervous system is the first thing to form because it makes you before you're born and it keeps everything working after. It's the most important system in your body. So, what does that have to do with your health? Well, remember I told you when we started, you're going to learn tonight what is health. Right, Edna? What does the dictionary say? If you look up the word health in the dictionary, what does it say? What is health? Health is probably the most important thing to you because if you lose it, what do you lose? Everything. Yeah. It's the most important thing. We do anything to get it if we needed it, but we don't know what it is. Is it the absence of symptoms? Are you healthy just because you don't have any back pain? Are you healthy just because you're breathing? Is it possible to have no pain and actually have cancer devouring your body? God forbid, yes. Or the absence of symptoms. I mean, just because, well, maybe you do have symptoms. Maybe your back does hurt. Does that mean you're unhealthy? No? How many of you guys have seen that? Both situations, both sides. The presence of symptoms or the absence of symptoms does not necessarily indicate health. There's something that supersedes that. If you look it up in any dictionary, the operative term is going to be what? Function. When your body's functioning 100%, you're healthy. Right? James, if your heart is functioning 100%, what's the likelihood you get a heart attack? Little to none, right? Bela, if the cells in your colon are functioning at 100%, what's the likelihood you get colon cancer? Little to none. Because God doesn't make junk. And so if everything is working the way it was created to, then you're healthy. So what controls function in the human body? Which system? Your nervous system, yeah. If you cut the nerves going to the heart, no function. If you cut the nerves going to the eyes, you go blind. So this is the most important system, right? You go to every doctor, they check your blood pressure, your cholesterol, your blood sugar, they do a mammogram, prostate. When you go to your doctors, what's the one system that they do not check? Your nervous system. But yet it controls everything, all your health, all your healing. It's the most important system. Okay, so now that we know that, what's the difference between you and a person with a toe tag? Somebody down in the morgue who died yesterday. Do they have a nervous system? Yeah. Dead person has a brain. Dead person has a spinal cord. Dead person has organs. They have blood. May not be circulating, but they have all the parts that you have and I have. What does a dead person not have that you and I have? Life. Very good. Life. Life is what uses your nervous system to express itself. So your body can adapt to its environment. So it can adapt to stress. So it can keep your heart beating. Make it faster. Make it slower. If a tiger or an elephant or a lion jumps out at you, you got an adrenaline rush. It's going to start going. You don't have to think about it, do you? You don't have to plug yourself in to keep your heart beating when you go to sleep, right? It's all under the control of an amazing intelligence. You eat food, body digests it, takes the nutrients, sends it to exactly where it needs to go. Right place, right amount. There's cancer in your body, you don't know it, your body does, takes all those nutrients, takes the white blood cells, goes to work on it and kills it off. Only if your nervous system has free and clear communication, no interference to it. Right? Is that important? Okay. Very important. So, it's not your nervous system that's the most important thing. It is the intelligence that uses your nervous system. You all have computers, right? You have a hard drive, but if you don't have software running that hard drive, what do you have? Nothing. A dead computer. Innate intelligence. The amazing intelligence, the infinite wisdom that God has created you with and put inside of your body is what uses your nervous system to keep you healthy, functioning, and adapting to your environment. So your nervous system is a conduit. It's important, but a dead person has one too. Does everybody see the difference? Are you with me right now? This is the most important thing I can share with you. Because if you get this, you're going back to that picture with the spouses sitting together, quality of life, health, peace, joy, all those things comes from understanding this. We're working with the most amazing thing. 75% of heart attacks are triggered by your autonomic nervous system, right? The vagus nerve, raise your hand if you've heard of the vagus nerve. Very good. The vagus nerve is what modulates your heart activity by relaxing the heart when the peripheral nervous system or the parasympathetic nervous system is stimulated. What stimulates the parasympathetic nervous system? The adjustment at the atlas. Everyone say atlas. Very good. So the reason why you get you get really relaxed. How many of you guys have ever noticed that? When you get adjusted, you kind of feel really relaxed right after. Like sometimes you're even a little woozy when you get off the table, but you feel really relaxed. Sometimes you even go and take a nap. Why? Because your parasympathetic, the slowing down, the rest and digest part of your nervous system has been activated. People in a regular chiropractic care have better autonomic nerve system balance because most people are in fight or flight. When you get an atlas adjustment, it stimulates a parasympathetic to bring that back into balance. Make sense? And that allows your body to be more able to handle stress, effectively reducing your risk of a heart attack, cancer, colds, flus, etc. Wow! Turn to your neighbor and say, "That's awesome!" That's awesome. So, all right, so here's the upper cervical. Looking at the back of my head, right under my skull, you see the atlas. Okay, so the left vagus nerve, you see those little nerves coming out of the skull? Go right in front of the atlas. And then on the right side, you have the vagus nerve that comes out of the skull, goes right in front of the atlas. Right in front. It's like it drapes almost right over it. So that atlas has to be in the perfect position without messing with that vagus nerve. If it does mess with the vagus nerve, it changes the tone of the vagus nerve, which can stimulate that sympathetic part of your nervous system. And so here's the difference. On the left, you have normal. On the right, you can see the atlas tipped. How many of you remember seeing something like that on your x-ray? Now you know why I made a big deal out of it. Because it's right there on your brainstem affecting the vagus nerve. And that can cause digestive problems, it can cause sleep problems, it can cause anxiety, it can cause your immune system to be weak, your moods, facial problems, TMJ, and of course, like we're talking about tonight, your heart rate, your blood pressure. So this is the number one factor, guys. You can eat good, take supplements, exercise till the cows come home, but if you're subluxated, you're in big trouble. You're in big trouble. There's nothing, there's no supplement, there's no special exercise or diet that can fix that, or medication for that matter. Right? What's the only thing that can correct that source of interference to a person's nervous system? An adjustment, yeah. So what does that do to your risk of heart attack? It increases it significantly. Share with you this real quick.
GMA on call. Millions of Americans take medication to lower their blood pressure, but new research suggests there may be a better solution. The idea is that some people may be able to toss their pills and visit a chiropractor instead. So how would it work? And is this method right for everyone? 1 in 3 adults suffer from high blood pressure. Nobody can say for sure what makes it rise, but now a new medical study is cautiously suggesting an unusual way to bring it down. Realign the spine.
When the spine is misaligned, it can affect all types of things, all types of diseases, conditions.
The idea is that the C1 vertebra, located at the top of the spine, operates like a fuse box in the body. When twisted, it can pinch arteries and nerves at the base of the neck, not only causing discomfort, but affecting blood flow too. Denise Neiman suffered from neck pain.
Your upper body is off to the left 2 degrees. And
X-rays showed her C1 out of alignment. A special chiropractic adjustment lowered the pain and her blood pressure at the same time.
My blood pressure dropped tremendously.
Could there be a connection?
We designed a double-blind study to really look and see if, in fact, this procedure was affecting blood pressure.
25 patients got the special adjustment, 25 others a fake one. The ones who got the real thing saw their blood pressure drop an average of 17 points, a dip that usually takes 2 blood pressure medications to achieve.
Okay. So some of you are probably thinking, wow, that's awesome. Now you can use an adjustment to lower your blood pressure instead of the medication, right? Not so fast, not so fast, not always. All right? Lots of people have conditions for different reasons. Now, it just so happened with that lady, that was causing her high blood pressure. But you know what? I take care of people and I do the same thing, and they have high blood pressure and their blood pressure doesn't go down. Does that mean that chiropractic doesn't work? No, it just means that there are other things that are causing or contributing to that condition. Are they better off without the atlas subluxation and the high blood pressure? Or should we leave the subluxation there on top of it? No. We leave the mass confusion in the body. No, yeah, take that out. So what is the purpose of a chiropractic adjustment? Is it to crack the neck to lower the high blood pressure? Is that why we do an adjustment? Is it to crack your back for pain relief? Or is it to correct subluxation? To allow 100% expression of innate intelligence? What would you say? What's the answer? You know, I didn't want to go over the whole quiz that's in your handout. You guys can do that later. Hopefully, if you're not sure of any of the answers, let me know. I would love to help you. But you got the most important one right here, to correct subluxation. Hey, by the way, let me ask you this. Can you adjust a dead person? What do you think, Dudley? That's a novel concept. Can you adjust a dead person, Sean? I see the wheels turning. Can you adjust a dead person? Like, if I just come over, can I crack a dead person's back? And you know, at first you'd be like, I think you can do that. Yeah, you probably can do that. Yeah, but okay. So my question was, can you adjust? Okay, can you adjust? So what is the definition of a subluxation? Anything that blocks the expression of what? Innate intelligence. Does a dead person have innate intelligence? A dead person doesn't have life. The subluxation is what chokes off life to your living body. If a dead person is not living, it doesn't have life, I cannot make an adjustment to it. Can I crack its back? Maybe, but that's not an adjustment. What does an adjustment do? It turns on life. What does it do? Turns on life. It's like going to the dimmer switch. Turn it up, turn it up. See that? Get reconnected. That's all of my kids. Not one of them ever I adjusted because they had back pain. I adjusted them the day that they were born. Why? Because I wanted to make sure they had 100% expression of life, of innate intelligence. I wanted them to be 100% of what God created them to be. Raise your hand if you want to be 100% of what God created you to be. Yeah, all of us. So, isn't that your birthright? Isn't that everybody's birthright? So why is it that not everybody on the planet is getting their spine checked on a regular basis? It makes sense. If what I'm saying makes sense, everybody should be having their spine checked on a regular basis. What's the problem with that? People don't understand chiropractic like that. They think it's for what? Cracking their back for pain relief. Yeah. So now you're getting the big picture, guys. So subluxation can occur in the neck. It can affect your blood pressure. It can actually be a source of problem in the upper back. You see that? T2 right there? Heart, lungs, can cause functional heart conditions, certain chest conditions, shortness of breath. So, you know, we can go down this whole line. You can find any health condition known to mankind have a source of the spine which could be the cause of the issue. And most people don't know that. They go to doctors, and what do? They take medication because they don't know. What causes subluxation? What causes the vertebrae to shift out of alignment? Right here. What do those three words say? Trauma, thoughts, and toxins. Those are each different types of stress. The three T's. The three what? Three T's, yeah. Trauma, well, what do you see down here? You see kids falling off of bikes. You see babies being yanked out of the birth canal, which is probably 98% of all children born today are subluxated the minute they're brought through the birth canal. At least 98%. Most studies point to 90+%. Many studies, medical studies, or osteopathic studies have shown this time and time again how traumatic the birth process is. And can you imagine kids being subluxated, pressure on the brainstem, shutting their immune system down, getting ear infections, asthma, allergies, going to the doctors, getting antibiotics, and never getting an adjustment. Never looking in the right place to correct the cause of it all along, starting on day one. I thank God that I knew this because my kids never had to go through that. They had their adjustments from day one. Never had any of that stuff. They've never had a prescription drug in their body. They've never been to a pediatrician, not even a medical doctor. Been to the hospital for stitches and stuff like that. But as far as health goes, this is the most important place to start with your kids when they're little. And then we see all these other things, right? And so, again, people are not looking for a chiropractor until they have what? Until they have pain. Can you feel the pressure on the nerves initially when the bones shift out of alignment? No. For most of us, it's there for years or decades before we actually feel it. Silently choking off life, causing sickness and disease. And I sat and I put this together because this kind of sums up our healthcare system. Remember I told you we started with this? Now we're going to finish with that. That picture in the upper left-hand corner, right? See the happy, healthy couple, and then you see the guy that's dying. This is where it all comes full circle. You know, one future or the other. How you approach your health and how you approach your health or disease. So if you look in the middle, you see the brain up there, and then you see the cell down there. You see a healthy cell. What does the brain need to do to help the cell? It needs to communicate with it. 100% of that life needs to get to that cell. So the cell needs to get 100% too, right? And then, through the nervous system, that cell's going to communicate back to the brain, telling the brain what's going on. Is all hunky-dory? All well? Or do I need any help down here? Right? And that communication system should be open. 100% of the brain, 100% of the body, all the time. Right? Okay. What happens when you have subluxation?
Cuts it off.
Cuts it off. So Dr. Chung Ha Su at the University of Colorado found the weight of a dime on one of these spinal nerves can shut off at least 50% of the nerve supply within 3 minutes. How much? 50% of the nerve supply in 3 minutes. Yeah. So now you don't have healthy cells. Now you have what?
Disease.
Yeah, it's choking off life to the body. Those cells are dying. Now you don't feel that. You don't have any symptoms until you have a lot of that in an organ, whether it's your heart or your liver or your pancreas, right? And then once you have a disease, then you go to the doctor. What do they give you? Pills, yeah. The body's been crying out to the brain, help, give me help, give me help. But the brain can't get the healing signals back to the body because of the interference. So the doctor comes in, doesn't correct the cause. Medical doctor comes in, prescribes a cocktail of lies in the form of medications, prescriptions, to trick the brain into thinking everything's hunky-dory. Oh, we've got this leveled out, we've got that leveled out, no problem. Have we created health with this situation? No, we've created good-looking lab reports, good-looking blood work, hiding the sickness and disease. The two most dangerous forms of interference to the innate intelligence, the amazing intelligence that God created you with. This is the picture of sickness, disease, and early death, never correcting the cause. How do you correct the cause? Adjustment. What else can interfere with that? We said the 3 T's, right? We said trauma, thoughts, and toxins. Correcting the subluxations is the first part. What about if your body's toxic? We talked about getting bad fats out, right? What else? Other toxins, biotoxins, mold, mercury, all these things that we're putting in our body, flu shots, all that crap, right? That's in there. That's interfering with your nervous system also. Thoughts, we talked about stress, all that interferes. So the more that we can remove out of the way, the more clarity that we can bring the brain and the body into relationship with one another. You remember on the old radios, they had static in the station? You come over to that knob on the right, not the volume one, the one on the right, which would tune in the station. And what did you do? You dialed it in so that the music would come in crystal clear. That's what a specific adjustment does in the right place at the right time. So the cells hear clarity, a clear message from the brain, and they can function properly and restore health and healing. All right? And then once that's done, then what do we have? A clear, open pathway. And so, sometimes that happens just like that. I had a lady walk in here, and she was bent over like this, and she said, check out my back, it's hurting. So I took her to the back, and I got an x-ray, and I said, okay, come, lay down, let's get you adjusted. And I gave her an adjustment. And she got up off the table, and she wasn't like this. She was standing up straight. I said, wow, that's good. I guess I did good there. So come back tomorrow. Let me just make sure you're doing okay. I noticed when she stood up, she had an insulin pump on. I didn't say anything. She's diabetic. She leaves, and about an hour later, she's passed out in her car. I call the ambulance. The ambulance comes, picks her up. I don't know what happened, but I ran out there and I gave her some juice because I knew she was diabetic. She started coming to. The ambulance came, took her away. I thought I was in big trouble. I thought, somebody leaves from your office in an ambulance, is that a good thing? No. You're thinking about how many lawsuits you're going to get from how many attorneys. And so I didn't sleep too much that night. I came into the office the next morning and I was studying the films, trying to figure out what to do. Turns out that the subluxation that she had, the pressure on the nerve in her back, was the same area in her mid-back that was feeding off the nerve supply to her pancreas and her stomach. And when I gave the adjustment and I opened up the nerve channel, not only did it get rid of her pain and she was able to stand up straight, but it opened up the nerve supply to her pancreas, and her pancreas started regaining function, and it started making insulin again. But her pump was still on, so she got too much. That's why she passed out. I showed her this when she came in. She came from the hospital that morning. She came right to my office. You know why? She said, Dr. Yachter, I haven't slept this good and felt this good in 40 years. I'm here for another adjustment. I'm like, phew, praise the Lord. so I gave her another adjustment. I kept taking care of her. She never missed an appointment. She just had never felt that good because her body was starting to function and heal again. Well, her first progress evaluation showed that her endocrinologist had started reducing her insulin requirements. She went from 8 units. A month later, she was down to 5 units. A month later, she was down to 3 units. 5 months into care, she was down to 0.8 units from 8 units. Her doctor wanted to know from me what my clinical protocol was for reversing diabetes. Wow, that's amazing. Is that like a new thing? That they're actually using adjustments to cure diabetes? Is that what happened? No. Is the chiropractic, hopefully you learned this thing, is the chiropractic adjustment a treatment for anything? The first chiropractic patient had his hearing restored. He was a deaf man, September 18th, 1895. Harvey Lilly, that was the first patient, had his hearing restored. Does that mean the first adjustment was a treatment for hearing? No. That lady that I adjusted, her type 1 diabetes reversed. Was I trying to cure diabetes? No. Is chiropractic a treatment for anything? No. It's different. It's not like medicine. It's not like medical diagnosis and treatment where you actually do something to the body. The chiropractic philosophy is different. It recognizes the intelligence that the body already has in it. You're the best walking pharmaceutical office on the planet, right? You're an amazing piece of art that God created. So we don't seek to improve on that, right? We seek to remove the interference and allow the expression of that amazing intelligence inside. The only thing that it requires is time. Healing takes what? Time. Yeah. So the most important thing I can share with you tonight is this, guys. If you understood this, and most of you do, then the most important thing is not starting chiropractic care. The most important thing is what? Continuing. Yeah. Why would you, number one, ever want to go back to feeling as horrible as you did on the day that you got here? And number two, knowing all of the anatomical, biological, physiological facts that I just showed with you about the nervous system and chiropractic care, why would you want to unplug from that? You can't be better off without proper nerve supply. The most important thing is the adjustments. And studies show this. Wellness chiropractic patients who've been under care for 5 years or more have 60% fewer hospital admissions, 62% less surgeries, 85% less pharmaceutical costs. They did a 5-year study with people under wellness maintenance care versus senior citizens who were not under maintenance care. And these were the results. I mean, obviously you can tell people with good posture, they live longer. The study's been around for many, many years that show that. So, did you learn something important tonight? So how do you apply it? Like, who needs to know what you learned tonight? You learned the truth, right? Who deserves to know the truth? Everybody. The question is, how do you share it with people? You know, like the second that you mention the word chiropractic, what is it? I didn't have a car accident. My back doesn't hurt. We didn't talk about any of that tonight. We talked about where health comes from. We talked about function and healing in the nervous system. Just so happens that your backbone protects all that. And you got to get it checked to know. And so that's what needs to be shared. Now, it's easier for me because I've been doing it for a while. Not as easy for you. That's why I say, bring people here. Bring guests, bring friends, bring family members, bring loved ones. They'll hear the message and it makes sense, right? How does it not make sense? Or bring me to your group. Bring me to your church. Bring me to your place of work. You know, people deserve to know the truth. I can't tell you how many times I've done these talks at places outside the office, and you know what I hear? What took you so long to find me? That's why I get up in the morning and I remind myself every day there's people out there that are looking for an answer. They're looking for help. And you know what? We're God's hands, we're His ears, we're His eyes. We're His servants. So my wish and my prayer is that you remember that. Remember the opportunities. They're all around us. All right, so if you're a guest here and you have not had your spine checked, here's how you make application with this. The way that we do an examination of someone's nervous system is with thermography and with x-rays. And if you look on the left, you'll see NASA Space Technology, which does a heat reading on the spine and shows you where the problems are compared to a normal one. Now, if you have health issues, very often the scan and the x-ray will highlight where they're coming from and why. Sometimes you don't have any obvious problems or symptoms, and it's kind of like going in for a blood test or you go in for a regular exam. And sometimes they find things. And that's what this is for also. It's a health screening. When's the most important time to find a problem? Before or after it rears its ugly head? Before, right? Yeah. So that's why we do this. When a new patient comes into our office, we'll do a consultation, and we'll do an examination, we'll do the thermal scan, we'll do the x-rays, and then I study everything. And then I provide a full report, a follow-up report on the next visit, reviewing the x-rays, giving you detailed answers about what our findings are and any recommendations that you need. Normally, it's over $500 for all that. But if you're a guest here tonight, we have a gift for you. This is a certificate which allows all that to be done for only $97. All right, so we don't very often include the x-rays in this. So this is an amazing gift on behalf of the person who invited you tonight. So if you would like to apply everything that we talked about and have your nervous system checked and your spine, please see them at the front desk. You have 2 weeks to use this. So if you're a guest here, please don't leave without seeing them at the front. If we can help you with this, I'd love to get a chance to meet you. And for everybody else, don't forget to get your supplements. They're 15% off tonight only. If you want the body composition analysis, they'll make that appointment for you. Or the blood testing for the fingerprint, the omega-3 and the vitamin D, C-reactive protein, if you want to have that done, let them know at the front. They'll make whatever appointments or help that you need there. So that's all I've got for you. Thank you so much. I love and appreciate you guys. Thank you for being here. You're awesome.